Good morning, medical students. Today we will delve into the fascinating field of otorhinolaryngology, specifically focusing on the comprehensive management of maxillofacial trauma. Maxillofacial trauma involves injuries to the face, skull, and oral cavity, often resulting from accidents, falls, sports-related incidents, or violence. As future healthcare professionals, it is crucial for you to possess a thorough understanding of the various types of maxillofacial fractures, their clinical presentations, and the appropriate treatment strategies to ensure optimal patient outcomes. This topic focuses on the classification and management of Lefort fractures, specifically Lefort I, Lefort II, and Lefort III. We will discuss their clinical presentation, appropriate treatment strategies, surgical techniques, timing of intervention, and potential complications. Panfacial fractures affect multiple facial bones, impacting appearance and function. This video covers diagnosis, surgical planning, and treatment options for panfacial fractures, including occlusion, symmetry, and soft tissue management. Topics discussed include CT scans, 3D imaging, and clinical assessments. Mandibular condyle fractures are common maxillofacial fractures that affect jaw function. This topic covers evaluation using imaging modalities, treatment options, and their impact on long-term mandibular function. Orbital blowout fractures result from blunt trauma to the eye region, leading to defects in the orbital walls. Clinical assessment of these fractures is essential for determining the appropriate surgical approaches for repair and reconstruction. We will discuss the diagnostic evaluation of orbital blowout fractures, including the use of ophthalmic exams, imaging modalities such as CT scans, and considerations for managing associated complications, such as enophthalmos or diplopia. Furthermore, various surgical techniques and materials for orbital wall reconstruction will be explored in detail. Midface trauma involves fractures of the maxilla, zygomatic bone, and nasal bones. Understanding the patterns of injury in midface trauma is pivotal for planning effective reduction and fixation techniques. This topic will provide an in-depth analysis of the different patterns of injury seen in midface trauma, including Lefort fractures, zygomatico-maxillary complex fractures, and nasal bone fractures. Furthermore, we will explore the surgical techniques employed for reduction and fixation, as well as considerations for restoring facial aesthetics and function. Nasal fractures are prevalent in facial trauma and require appropriate reduction techniques for optimal appearance and function. In this topic, we will explore the various reduction techniques employed for nasal fractures, including closed reduction and open reduction approaches. Emphasis will be placed on potential complications that may arise during reduction, such as septal deviation or the development of nasal deformities. Additionally, we will discuss the importance of postoperative care and the management of complications to ensure optimal outcomes for patients. Gunshot wounds to the face can inflict devastating injuries, necessitating timely and comprehensive management. This topic will focus on the acute management of gunshot wounds, including airway management, hemorrhage control, and infection prevention. Moreover, we will explore the long-term outcomes and potential reconstructive procedures involved in the rehabilitation of patients with facial gunshot injuries. The importance of collaboration with other specialists, such as plastic surgeons and ophthalmologists, will also be emphasized. Soft tissue injuries in maxillofacial trauma can significantly impact both aesthetics and function. In this topic, we will discuss the repair techniques for various types of facial soft tissue injuries, including lacerations, avulsions, and contusions. Focus will be placed on achieving optimal cosmetic outcomes while considering wound closure techniques and scar management. We will explore different suture materials, wound dressing options, and potential complications associated with facial soft tissue injuries. Temporomandibular joint, TMJ, injuries are common consequences of maxillofacial trauma, resulting in pain and functional impairments. This topic will explore the diagnostic tools used for TMJ evaluation, such as clinical examinations, imaging modalities such as MRI, and arthroscopy. We will also discuss non-surgical management options for TMJ injuries, including pain management, physical therapy, and the use of oral appliances. Lastly, we will delve into the referral process to specialist care if non-surgical interventions prove inadequate. Facial nerve injuries can occur as a result of maxillofacial trauma, leading to facial paralysis and functional deficits. In this topic, we will explore the diagnostic evaluation of facial nerve injuries, including electromyography, EMG, and nerve conduction studies. Surgical interventions, such as nerve repair or grafting, will be discussed in detail, along with postoperative care and rehabilitation techniques to optimize facial function. We will also emphasize the importance of early intervention to minimize long-term sequelae. Dental injuries are commonly associated with maxillofacial trauma, presenting as dental avulsion, complete tooth loss, or luxations, tooth displacement. This topic will provide a comprehensive overview of both immediate and delayed treatment approaches for dental avulsion and luxations. Proper management of the tooth socket, repositioning techniques, and considerations for splinting will be discussed in detail. Additionally, the importance of preserving tooth vitality and the role of endodontic treatment will be explored. Maxillofacial trauma in pediatric patients requires special attention due to anatomical and physiological differences. This topic will explore the unique considerations in managing maxillofacial trauma in children, including age-appropriate imaging techniques, growth-related issues, and specific treatment strategies aimed at preserving facial growth and development. Moreover, we will discuss the importance of interdisciplinary collaboration with pediatric dentists, orthodontists, and craniofacial specialists to optimize outcomes in this patient population. In conclusion, managing maxillofacial trauma requires understanding fractures, diagnosis, and treatment. Acquire comprehensive knowledge in these topics to provide excellent care and improve the lives of facial injury patients. Good luck in your future endeavors as otorhinolaryngologists.